If you haven't had sex in a long time, here's a truth that sounds backwards, but is actually freeing. Your body doesn't expire because you took a break. Your system just gets out of practice, and systems can be rebuilt. Today, we're going to talk about what really changes during a long dry spell, what's pure myth, and the science-based habits that help you keep your sexual health steady, whether you're partnered, single, healing, overwhelmed, or simply not in that season. All right, let's start with the myth that messes with people's heads the most. Myth number 1, use it or lose it. A lot of people believe that if you don't have sex for a long time, you'll permanently lose function, like a door that locks and never opens again. Here's the reality. Human sexual anatomy is built to adapt. Taking a break doesn't permanently ruin you. What can change over time is more subtle, things like blood flow patterns, muscle tone patterns, arousal cues, and most importantly, your stress response. Think of it like fitness. If you stop running for 6 months, your legs don't disappear, but your conditioning and confidence shift. Sex is similar. It's not just one body part, it's a whole body system. And that's where the real conversation starts. The real system: brain, nerves, blood flow, muscles. Sexual response, regardless of gender, usually involves 5 major pieces working together. First, the brain: attention, desire, comfort, and a feeling of safety. Second, the nervous system: the signals that turn maybe into yes, my body is responding. Third, blood flow: healthy circulation supports healthy tissue response. Fourth, muscle coordination, especially the pelvic floor. Not just strength, but also the ability to relax. And fifth, hormones and body chemistry. They influence things, but they don't fully control the outcome. So during a long break from sex, the body isn't punishing you. It's simply using those pathways less often. And here's the key. Keeping those pathways healthy doesn't require partnered sex. It can be supported through sleep, movement, stress regulation, and healthy arousal patterns. Now, let's talk about what people might notice without fear. What you might notice during a long break. Not everyone experiences changes, but some people do, and usually they're manageable. 1. Less spontaneous readiness. After a long pause, you may need more time to feel mentally and physically ready. That's not failure, that's normal. 2. Your startup might feel slower. You might feel a little awkward the first time back, like you're relearning. Because you are. Relearning is not the same as being broken. 3. Mind-body mismatch. Sometimes you want intimacy mentally, but your body is slow to follow. Or your body reacts, but your mind is anxious. That mismatch is usually about stress, expectations, and habits, not permanent damage. And that leads to the next myth. Myth number 2. If I stop, my libido disappears. People worry that if they take a break, desire will just fade away forever. But libido is not a switch. It's more like a volume dial, and it responds to a lot of inputs: sleep quality, stress levels, relationship dynamics, body image, depression and anxiety, alcohol, medication side effects, novelty, and emotional connection. The more helpful question is your libido low and you're okay with it? Or is it low and it bothers you? If you're content, that can be perfectly healthy. If you're distressed, that's worth exploring without shame. Now, here's the factor that often matters more than people expect: the hidden driver, stress. Stress is a powerful libido killer, and it's also a powerful performance disruptor. When you're stressed, your body shifts into survival mode. Your nervous system leans toward fight or flight. And sexual response usually requires the opposite: rest, presence, safety, and time. So if you haven't had sex in a while and you feel off, Don't only ask, "What's wrong with my body?" Also ask, "What has my nervous system been carrying?" Because a lot of sexual issues are not about ability, they're about load. Now I want to make this real with two composite scenarios. These are not identifiable real people, just realistic patterns compiled from common experiences. Case study number 1. Younger adult, pressure, poor sleep, overstimulation. Picture a 27-year-old who's constantly busy, sleeping 4 or 5 hours a night, heavy caffeine, late night scrolling, and feeling isolated. He starts thinking, "I haven't had sex in months. What if I can't perform?" That fear turns into constant self-checking, and because anxiety demands certainty, he relies on intense stimulation to prove he's fine. Then real intimacy happens, and suddenly his brain is loud. Don't mess up. And the louder the brain gets, the harder it becomes to relax into response. So what changes things? Not a magic trick, a system reset. A consistent sleep schedule, daily brisk walking, less late-night screen time, and the biggest shift, he stops treating his body like a test he has to pass. 2 weeks later, the result isn't superhero level. It's something better: consistency and confidence. He notices better morning energy, less anxiety, and more natural response because his nervous system isn't on high alert. The lesson here: for many younger men, the issue isn't the dry spell. It's the stress, sleep debt, and habit loop around it. Now the second scenario, case study number 2, middle-aged adult, lifestyle and circulation. Picture a 49-year-old with long work days, low activity, regular alcohol, weight gain, and rising blood pressure. Sex becomes less frequent, and when it happens, response feels inconsistent. He assumes the problem is purely sexual, so he looks for quick fixes. But the foundation is the real issue: fatigue, stress, and circulation health. So he starts with basics. He walks most days. He adds 2 simple strength sessions per week. He reduces alcohol frequency. He improves sleep routines, and he gets a basic medical check to understand blood pressure and metabolic markers. Over several weeks, he notices better stamina, better sleep, and a more stable response. Not overnight, not perfect, but steadier, and that steadiness reduces anxiety, which further improves response. The lesson: in midlife, sexual function often connects to whole body health. That's not scary, it's empowering, because it gives you levers you can actually pull. Now, what if you're not having sex right now, and you want to stay healthy without pressure? How to maintain sexual health during a dry spell without partnered sex. Here's a practical checklist. First, sleep. If you fix one thing, fix sleep. Set a consistent sleep and wake time. Reduce screens before bed. And if you snore loudly or wake up unrefreshed, consider getting evaluated. Sleep quality impacts everything. Second, circulation. 20 to 30 minutes of brisk walking most days is a game changer. Add 2 strength sessions weekly. Not because you need a six-pack, because your vascular system loves movement. Third, stress regulation. 5 minutes a day of slow breathing with longer exhales can help shift your nervous system out of high alert. Journaling one worry and one next step helps too. You're not trying to eliminate stress, you're trying to metabolize it. Fourth, substances. Alcohol and nicotine can interfere with sexual response in different ways, especially long-term. You don't have to be perfect, just reduce the patterns that hit you the hardest. Fifth, stop performance checking. If you constantly test yourself, you train your brain to associate arousal with evaluation. That's the opposite of relaxation. Replace testing with rebuilding calm and realistic expectations. Now let's put all of this into a simple, trackable plan. The 14-day reset plan. This isn't a cure-all, it's a reboot designed to improve the foundations that sexual health depends on. Here's how you track progress. Each day, rate 0 to 10 for sleep quality, stress level, energy level, and confidence. Days 1 to 3, stabilize your nervous system. Pick a consistent bedtime and wake time. Walk 20 minutes daily. No screens for 30 minutes before bed. Days 4 to 7, build circulation and reduce tension. Walk 25 minutes daily. Add 1 short strength session. 5 minutes of slow breathing at night. Reduce late caffeine and heavy drinking patterns. Days 8 to 10, increase capacity. Walk 30 minutes. Do strength session number 2. Add protein and vegetables to at least 1 meal. Replace 1 doom scroll window with a calming routine. Days 11 to 14. Reinforce consistency and confidence. Keep the schedule. If you're partnered, talk about pressure. Remove it. Focus on connection. Review your scores. What improved most? Sleep, stress, or movement? For a lot of people, this plan doesn't just improve sexual response. It improves mood, energy, and self-respect. And those ripple effects matter. Now, let's cover when it's time to get medical support. Please don't white-knuckle your way through symptoms that deserve attention. Consider professional help if you have pain or persistent discomfort. You notice bleeding or urinary symptoms. You experience a sudden major change. You suspect depression or anxiety is overwhelming you. Or you have risk factors like diabetes, hypertension, or heart disease, and notice changes in sexual function. Getting checked isn't embarrassing, it's responsible. And sometimes sexual symptoms are early signals that your body wants broader support. Now let's end with the big lesson. A long dry spell doesn't break you, but it can reveal what your body has been missing: sleep, circulation, calm, and confidence. Here are 3 things you can do today. Go to bed 30 minutes earlier, just once. Walk for 20 minutes. Stop performance checking and start rebuilding your system. If you found this helpful, subscribe for more science-based, respectful sexual health content. And I want your take in the comments. What affects libido more for you? Stress, sleep, or relationship dynamics?